Welcome to Young Asia Television.
Presented by the National Science Foundation of Sri Lanka.
It is something that we have all taken at least once in our lifetime to stay healthy. I'm talking about medicine. Stay tuned to find out not just about the use of medicine, but how we can use them wisely.
නිල් පැහැයෙන් හැඩ වූ එකමලුවක් ඇත්තේ ගහකොළ මල් සුසැදී පනනල ඇත සුරැකී ජීවිතයේ විදුනැන අත්තරගත යුත්තේ අවනි පැයුම් බිහිවිය යුත්තේ සොබාදහම් සුරැකිය යුත්තේ අප සම නිරෝගී විය යුත්තේ ජීවිතයේ මේ සියලු රහස් ගැන දැනුවත් විය යුත්තේ විද්‍යාවෙන් තේරුම්ගෙන ලෝකය ජීවත් විය යුත්තේ
මේ මඩ
The term medicine is very broadly used and includes home medicine, traditional or Ayurvedic medicine, and Western or pharmaceutical products. Now, as we use Western medicine more often, we will divert our attention to this field of medicine. So what do we do when we fall sick? We visit the doctor and describe our symptoms. The doctor then examines us and prescribes a course of treatment. Then the doctor will instruct us and advise us on the dosage and the frequency of taking the medicine. Remember, it is important that you follow the doctor's instructions when taking medicine.
Chemical-based substances used to treat and cure diseases and restore bodily functions are commonly known as medicines. Medicines can take many forms, such as pills, capsules, solutions, creams, and injections. They can be administered to the body in several ways, including oral, rectal, and topical administration.
Most of us agree that our health is wealth. That is why we use medicines to stay healthy and to prevent and treat illnesses. Medicines are so important that they have become a part of our lives. But there's something very important to remember when we take medicines. Medicines will give the beneficial effects only if we use it in the correct way, in the correct manner. And to do this, we have to have a sound general knowledge about the medicines and how to use them.
In response to a rising demand, pharmaceutical companies worldwide mass produce a wide range of pharmaceutical drugs, or medicines as we call it. Such medicines are identified by their chemical, generic, or brand names. Therefore, it is important for customers to know the difference between these names.
The most important name that you should remember is the generic name of the drug. It's also known as the international non-proprietary name. This is the name by which the drug is known the world over by the doctors, the pharmacists, and the public. If you know this name, you can identify the drug without a problem wherever in the world you happen to go to. If you take the example of paracetamol, paracetamol is the generic name of the drug. It also has got a chemical name which is too complex. Paracetamol is manufactured and marketed by many companies world over. Therefore, it's in the market in a lot of brand names.
Pharmaceutical medicines can be classified into two categories: prescription medicines and non-prescription medicines, which are also known as over-the-counter medicines. It is important to take medicines correctly. When taking prescription medicines, one must adhere to the instructions given by the doctor. When taking non-prescription medicines, you should read the information and instructions in the medicine labels and containers and patient information leaflets that come with the medicines. Non-prescription medication can include certain types of vitamins, paracetamol, iron pills, calcium pills, Jeevani, aspirin, birth control pills, various medications that treat heartburn, gripe mixture, various cough syrups, and various cold syrups. The improper use of non-prescription medicine can lead to health complications. Therefore, it is important to know how to use these medications in a safe manner.
You can gather a lot of information about the medicines that you take from the labels of medicines as well as boxes in which they come. If you look at this box, it gives you the generic name of the medicine. It gives you the trade name of the medicine as well, and it also tells you the dosage to take. From this dosage table you can get the correct dosage, how to store the medicines, and also the expiry date. Now if you look at this expiry date, it says 11/14. What does this mean? It means that you can take this particular medicine until the end of November 2014.
Certain groups of people are more vulnerable to side effects and harm from medicines. Those who are suffering from chronic disorders or are already taking any other prescription or non-prescription medicines. Women who are planning a pregnancy or are in a stage of pregnancy. Breastfeeding mothers, infants, and the elderly.
Do you pay proper attention to the storage of medicine when you purchase them from the pharmacy? It is important that medicine is stored correctly so that they don't degrade and lose their effectiveness.
You should store your medicines in a cool, dry place away from strong sunlight. Why is this? Because the moisture and heat can spoil some medicines. You should refrigerate your medicines only if asked to do so. And if you are refrigerating your medicines, where should you put it in the fridge? You should store it in the middle compartment of the fridge. You should not store it in the deep freezer. Why not? Because the extreme cold temperature inside the deep freezer can spoil the quality of the medicines and their effectiveness. And if you leave the medicines out of the fridge, then you have to store it protected from ants, cockroaches, and mice and rats. And a special word of caution, if you have small children in the house, you have to be very careful to store the medicine out of their reach. If there are several people in the household using medicines at the same time, what should you do? You should store each person's medicines separately in a separate box, put a name label on it, and store it separately also.
Medicines or medication works in different ways. If they are taken properly, they can help cure illnesses and also prevent illnesses from further developing. While taking medicine can be beneficial to us, there are also occasionally minor side effects that are not much cause for concern. However, if it is a serious side effect or an allergic reaction, then we must be cautious and not take that medicine in future. Let's take a look at some of the more commonly experienced side effects of medicine.
An unforeseen turn in one's health. Exhaustion, constipation, diarrhea, loss of appetite, vomiting, headache, loss of concentration, incontinence, falls, weakness, drowsiness, excessive sleep or insomnia, anxiety, vertigo and fainting, skin rashes, boils, and warts are among the most common side effects anyone may experience when under medication.
Medicines prescribed for an illness or a condition will depend on the age and health status of a patient. For instance, the range of medicines available for infants and children are different to that of adults and the elderly. Also, medications prescribed to pregnant mothers will vary according to each stage of pregnancy. Let's first focus our attention to the safe uses of medication during pregnancy.
Pregnancy is a time of great hope for a mother-to-be. Naturally, every mother wants to have a healthy pregnancy and birth. Proper prenatal care, such as change of food habits and daily routines, are very important during this period. Expecting mothers also need to especially know what medications are safe and what medications are unsafe to take during this period.
When taking medicines in pregnancy, you should remember that any medicines that you take can reach the baby through the placenta. And the first 3 months of the pregnancy is very important, which we call the first trimester, because this is the time where the baby's organs are developing. Exposure to some medicines can cause harm to the developing baby and can lead to birth defects. Even after the first 3 months, you have to be careful when using medicines because certain medicines may cause some harm to the baby. If you are on long-term medicines, it's very important that they are controlled well during pregnancy. If you have epilepsy, diabetes, heart diseases, or any other long-term medical problem, it's important that you consult your doctor even before you conceive and plan what medicines are suitable for you to take during pregnancy. What if you have become pregnant and you have not had time to consult your doctor? You should not stop any medicines that you are taking on your own. You have to go and consult your doctor as soon as possible, and then the doctor will advise you on what to do. All women of childbearing age group should be careful when using medicines. Why is this? Because sometimes you may not realize that you are pregnant for 1 or 2 months afterwards. And during a crucial time of the baby's development, the baby may be exposed to unsuitable medicines.
Breastfeeding mothers must always consult a doctor before taking any medication, as some medications can reach the baby through the breast milk.
You should be careful when using medicines when you are breastfeeding your baby. Why is that? Medicines can reach your baby through the breast milk. So you should consult the doctor before you use any medicine long term or even short term. Most medicines can be taken safely during the breastfeeding period. However, a few medicines need to be stopped.
If you are a nursing mother, it is important to know that the medicine you take can affect your baby. The side effects may vary from breathing difficulties, drowsiness, skin boils, itchiness, and restlessness.
Utmost care and attention needs to be paid when giving medicine to newborns, babies, and children. Let's take a look at some of the important things that you need to know.
If you are a parent, a guardian, a preschool or school teacher, or anyone who spends time with children, there is something very important that you need to know. That is, how to safely give a child medicine when it is required.
Children are not small adults. Therefore, medicine preparations made for adults are not suitable for children because they may contain alcohol, salt, other preservatives and coloring agents. So what should you give your baby? As much as possible, you should give medicine preparations made specially for them. Sometimes adult tablets and capsules would have too high a dose, and even if you break them and give your baby, the baby is at risk of getting a higher dose. You should also be careful to give the correct dose to your baby. What is meant by a dose? It is the amount of medicine that you give at a particular time. You should also be careful to give the correct dose of the medicine to the baby. If you are going to a doctor, the doctor will prescribe the correct dose. But if you go to a pharmacy and buy an over-the-counter medicine like paracetamol, then it's up to you to calculate the dose properly. You can do this based on the baby's body weight and the dosing table which is provided with the medicine. Let's say you have decided on the dose to be given to your baby. Now you have to measure it properly. How do you do that? You have to always use the measuring device provided with the medicine to do this. Some mothers use the teaspoon at home to measure medicines. Is this a good practice? Unfortunately, no. Why not? Because if you look at the teaspoons in the market, some are very small, some are as big as tablespoons. Therefore, if you use these to measure the medicines, you may get an inaccurate dose.
Older people tend to take more drugs than younger people do because they have more chronic disorders such as high blood pressure, diabetes or arthritis. Medicines help restore bodily functions and improve the quality of life for older people. It has enormous benefits. But we must remember that as we age, we become more susceptible to the side effects of medicine. Therefore, we must be alert about any slight changes that we may experience when taking them. Caregivers too must be aware of this.
As we grow older, our bodies change and sometimes our systems slow down. The absorption of medicines from our bowel may be poor, and sometimes once the medicine reaches the bloodstream, it may stay longer in the body because our kidneys and liver are slow. So sometimes the doses that younger people take may not be suitable for elderly, and therefore you should be guided by your doctor about the doses to take. Meanwhile, with aging, you may have to take more and more medicines. Why is that? You may be on medicines for long-term illnesses such as diabetes, nervous problems, arthritis, heart diseases and so on. On top of that, sometimes you may get a urinary tract infection or a chest infection for which you need more medicines. So the way to take medicines may become complex because of all this. Some medicines may have to be taken 3 times a day, whereas some twice a day. Some may be taken at different times of the day. Some may have to be taken before meals and some after meals. Therefore, there is the risk that you may lose track of the way to take your medicines.
As people age, they may sometimes forget to take their medications on time. Many solutions have been introduced to address this problem. Pillboxes, for example, assist older adults to organize their medications.
If your relative has poor memory and finds it difficult to take medicines, there is a way that you can help out. That is to use a special box like this, which is called a pill box, to store the medicines. In this pill box, you can see the days of the week are marked like this: Monday, Tuesday, Wednesday, and so on. If your relative is taking medicines 3 times a day, then you can put the medicines into the little boxes like this: morning, noon, and night. If your relative is taking medicines at a particular time of the day, then you can mark it like this and put the medicines accordingly. If your relative is taking medicines twice a day in the morning and night, you can put the medicines in the relevant compartments.
මට ඇමොක්සිලින් කරල් පාක් විතර ගන්න පුළුවන් මේක ඇස්සට එහෙම පිටිසාවට වගේ.
ප්‍රෙස්ක්‍රිප්ෂන් එකක් තියෙනවද?
මම එකක් නම් ගෙනාවේ නැහැ.
ඇන්ටිබයොටික් වර්ග නම් තුන්ඩුවක් නැතුව එහෙම දෙන්නේ නැහැ. අනිවාර්යයෙන්ම වෛද්‍ය නිර්දේශය තියෙන්න ඕන. නැතුව අපි ඉෂුව කරන්නේ නැහැ බෙහෙත්.
මම කලින් එහෙම අරන් තියෙනවානේ.
ඒ වුණාට ෆාමසි වලින් එහෙම බෙහෙත් ඉෂුව කරන්නේ නැහැ මැඩම් ඇන්ටිබයොටික් වර්ග.
මට එහෙනම් මේ බබා බෙහෙත් වගේක් තියෙනව ගන්න පුළුවන්ද?
පෙන්නන්නකෝ. මේක 2013 පළවෙනි මාසේ අරන් තියෙන්නේ.
ඕ බබාට දැන් ඒ ලෙඩේම තමයි මේ ආපහු තියෙන්නේ.
එහෙමනම් කරන්න බෑ මිස්. මොකද මේ පන්න බෙහෙත් තුණ්ඩුවකට අපිට මේ බෙහෙත් ඉෂුව කරන්න බෑ. මොකද මේ එදා තිබුණු ලෙඩේත් දන්නේ නැහැ දැන් තියෙන්නේ. අනිවාර්යයෙන්ම
තමයි තියෙන්නේ.
ඒ වුණාට අනිවාර්යයෙන්ම මේ වෛද්‍යවරයෙකුට පෙන්නලා එන්න ඕන. නැතුව සාමාන්‍ය ෆාමසි වලින් බෙහෙත් මේ වගේ දේවල් වලට ඉෂුව කරන්නේ නැහැ.
Taking antibiotics without the doctor's advice can do us more harm than good. Sometimes we self-medicate or refer to an older prescription provided by our doctor because the medicine has worked on us before. We tend to take medicine over the counter because it's that easy. But never do this. Always be sure to consult your doctor before taking any type of medicine.
Antibiotics are medicines that are used to treat bacterial infections. They are not effective against viruses. But most of the times, the colds, coughs, and the sore throats that we get are due to viruses. Antibiotics have revolutionized the treatment of bacterial illnesses such as tuberculosis, leprosy, and so on. And they have made us live longer and live healthy. However, people tend to misuse antibiotics a lot. Some people buy antibiotics over the counter. Sometimes they just ask for 1 or 2 capsules of an antibiotic, which is a very wrong practice and can lead to development of resistance to bacteria. Sometimes people go to doctors and plead with them to write antibiotics for conditions where antibiotics are not necessary. What can happen if you use antibiotics like this? You are not getting any health benefit. And sometimes the antibiotics can cause allergic reactions and side effects in you. You are wasting your money unnecessarily. Sometimes the good bacteria that lives within you will be destroyed by the antibiotics, and the bad bacteria in the environment finds it easy to invade your body and cause illnesses.
Breathing difficulties, tightness in the chest, skin rashes, swollen lips, itchiness, fever, diarrhea, and feeling faintish.
And finally, on the program, we highlight some important things that you need to know when taking medicine.
Sometimes you may be taking Ayurvedic medicines, homeopathic medicines, other traditional medicines, and some over-the-counter treatment at the moment. When you're seeing a doctor, you should inform about all those medicines. Why is that? Because if you take all these medicines together, it can lead to drug interactions. Sometimes you might get bad side effects, and also the effects that you expect from the new medicines will not come about because of the ones that you are using already. You should not give medicines prescribed to you specially by a doctor to your friends or relatives. Why is this? A doctor would prescribe medicines to you after considering a lot of things: your health condition, the other medical problems that you have, the ability you have to tolerate particular medicines, your age, and so many other things. If you give medicines given to you by the doctor to your friends and relatives, even though they have the same symptoms, the diseases may be different. and also their ages are different, their allergic tendencies are different, and therefore sometimes the medicines may cause more harm to them than the expected benefit.
We take medicines to fight illnesses and keep ourselves healthy. As you would have understood from this program, the improper use of medicines can lead to disastrous consequences to our health. Health is wealth. So remember, the next time you take any medicine, be sure to have the advice of your healthcare practitioner and use medicine wisely. Thank you for watching. Goodbye.